Are you turning 65 and worried about Medicare? Are you already on Medicare and wondering if you missed anything? Well, you're not alone. Hi, I'm Rick Teska, the founder of Senior Market Solutions. If you haven't done it already, please take a moment to subscribe to our YouTube channel. Don't forget to click the notification bell and give this video a thumbs up. Every day, I talk to lots of Medicare beneficiaries. Whether they're new to Medicare or not, many have unanswered Medicare questions. Others were simply misinformed. Today, we're discussing the top 10 Medicare mistakes and how to avoid them. Stick with me for another installment of Teska's Top 10. So let's dive into the top 10 Medicare mistakes and how to avoid them. Medicare mistake number 1, assuming Medicare enrollment is automatic. If you're already receiving a Social Security check when you turn 65 years old, you'll be automatically enrolled in Medicare Parts A and B. If you're not yet receiving Social Security benefits, as is the most common scenario, you must enroll on your own. Most people sign up for Part A at 65 since it's usually free. The decision to sign up for Part B depends more on your situation. For example, if you or your spouse has coverage through a current employer, you may choose to delay your Part B enrollment. Medicare mistake number 2, failing to understand Medigap standardization. Medicare supplement policies are standardized. Companies can choose which to sell, but the benefits and coverage must abide by federal standardization guidelines. Each plan is assigned a letter, A through N, and has a corresponding set of benefits covered. A Plan G at one insurance company is the same as a Plan G at another. Not every plan is available in all states. Also, 3 states standardize their plans differently: Massachusetts, Minnesota, and Wisconsin. If you live in Minnesota or Wisconsin, we've created videos just for you. Check for links in the description and comment sections. Medicare mistake number 3, not reviewing your Medicare Part D plan each year. An important part of Medicare is the prescription drug program known as Medicare Part D. The out-of-pocket costs for each plan can change dramatically from year to year. In addition, some insurers might present more coverage restrictions than others. Married couples often make the mistake of choosing the same Part D plan, thinking it'll be simpler. But that's just not true. Doing that could cost significantly more. Unless both spouses take the exact same prescription medications, there's a good chance that the plan best for one isn't the best for the other. It's a smart idea to take a fresh look at all your Part D options. Medicare mistake number 4, missing your Part B enrollment deadline. If you have coverage through an employer with 20 or more employees, you don't have to sign up for Medicare at 65. Instead, you may choose to keep coverage through your employer so you don't have to pay the Part B premiums. However, you must sign up within 8 months after you leave your job. Otherwise, you may have to wait for one of the next Medicare enrollment periods, which is January through March, for coverage to begin on July 1st. That means you could go for several months without coverage. You may also get hit with a 10% lifetime late enrollment penalty, which could cost you thousands of dollars. Medicare mistake number 5, misunderstanding the Medicare supplement open enrollment period. This is one of the most common mistakes I see people make when they enroll in Medicare. Starting from the first day of the month in which you are 65 or older and enrolled in Medicare Part B, you have 6 months to enroll in a Medicare supplement with no health questions asked. This one-time window is called your Medigap open enrollment period. Once that window is gone, it's gone. Anytime after your 6-month Medigap open enrollment period, you'll be required to pass medical underwriting to get a Medicare supplement plan. Similarly, Medicare beneficiaries often think they can initially enroll in a Medicare Advantage plan and switch to a Medicare supplement when they get sick and want that Medigap coverage. This simply isn't the case, as their current health status may prevent them from passing underwriting. Medicare mistake number 6, ignoring your annual notice of change. The annual notice of change is sent to all Medicare Advantage beneficiaries prior to the annual enrollment period. It identifies changes to plans and costs that will go into effect the following January. If you ignore these details, it could end up costing you thousands in out-of-pocket expenses. Your annual review is also a prime opportunity to evaluate whether a Medicare Advantage or a Medicare supplement is a better coverage option for the years to come. With a supplement, you don't have to worry about an annual notice of change because your benefits and coverage remain the same. And coverage is guaranteed for life as long as you pay your premiums. This is often confused and overlooked, leading many folks to make an ill-informed choice. Medicare mistake number 7, making assumptions about spousal coverage. Medicare coverage doesn't work like employer-based coverage. Don't assume your spouse is covered just because you are. If your spouse isn't 65 or doesn't yet qualify for Medicare Part A, then he or she will have to find coverage elsewhere. For example, through his or her employer group plan, a COBRA plan, or a policy sold on the health insurance exchange. We've got a great video about Medicare and employer group insurance. You'll find a link in the description and comments section. Medicare mistake number 8, not staying in-network on Medicare Advantage. If you sign up for a private Medicare Advantage plan instead of Original Medicare, you'll need to use that plan's approved network of providers. Otherwise, you risk incurring heftier costs. The out-of-pocket limit may be as high as $6,700 for in-network services and $10,000 for out-of-network services. Some Advantage plans won't cover out-of-network services at all, with emergency care being the sole exception. Pay attention to the providers you use and aim to stay in-network to avoid potentially devastating out-of-pocket costs. Medicare mistake number 9, forgetting to plan ahead financially. Did you know that your adjusted gross income matters? In 2020, most people pay $144.60 per month for Medicare Part B premiums. But if your adjusted gross income is more than $85,000, you might have to pay up to $491.60 per month in 2020. Plus, you'll likely have to pay a high income surcharge for your Part D prescription drug coverage, too. That can boost your premiums by more than $75 per month. Medicare mistake number 10, not realizing you may qualify for help lowering your costs. Medicare comes with many expenses. If your income is limited, there are 2 programs that can reduce costs for those that qualify. The Medicare Savings Program may help you pay some or all of your Part B premiums. Extra Help is a federal program that can help you get low to no cost Part D prescription drug coverage. So that's the top 10 Medicare mistakes and how to avoid them. When it comes to Medicare, the more you know about the program, the better position you'll be to make smart decisions. Thanks for tuning in for this installment of Teska's Top 10. In case you're interested in binge watching more episodes, we'll include the playlist link in the description and comments section. Hey, did you like this YouTube video? If so, you'll probably enjoy watching our latest one too. Just click on the video here to watch it now, or click on the playlist here to watch a selection of our most popular content. The Senior Market Solutions team is always developing new educational videos about Medicare and Medigap. Thanks for watching.